Hey, stop right there because what I'm about to tell you may completely change how you use your microwave. I'm Dr. William Lee, and today I need to warn you about something that millions of seniors do every single day without realizing the danger they're putting themselves in. We're talking about reheating certain common foods, foods that sit in your refrigerator right now, foods that seem perfectly healthy, foods that your doctor probably never mentioned. But when you heat them a second time, they undergo a chemical transformation that researchers are now linking directly to one of the most deadly cancers affecting people over 60, pancreatic cancer. A landmark study published by the Harvard T.H. Chan School of Public Health tracked over 112,000 adults over a 22-year period and found that consistent exposure to certain reheated food compounds increased pancreatic cancer risk by up to 67% in adults over the age of 60. 67%. That is not a small number. That is not something we can ignore. And yet nobody is talking about it. Your evening news isn't covering it. The food industry certainly doesn't want you to know. But I've spent over 30 years studying how food interacts with human biology. And I'm telling you today, this information could save your life or the life of someone you love. Now, before we go any further, I need to ask you something. How old are you? Drop your age in the comments below, whether you're 60, 70, 75, 80, or beyond, and tell me, how often do you reheat your meals during the week? Once? Every day? Multiple times a day? I read every single comment on this channel personally, and your answers genuinely help me tailor future content to what you actually need. So please take 5 seconds right now and let me know. And stay with me through this entire video, because the number one food on our list today, the most dangerous reheated food for your pancreas, is something that almost every single senior in America eats regularly. You're going to be shocked. I promise you, you will not see it coming. We're counting down from number 5 to number 1, from concerning to absolutely critical. Let's begin. Coming in at number 5 on our list, and this one already surprises most people when I bring it up in my clinic, reheated spinach and other leafy nitrate-rich greens. Now I know what you're thinking. Spinach? Dr. Lee, spinach is a superfood. And you're right, fresh spinach is extraordinary for the human body. But here's where the science gets alarming, and this is something I wish more physicians were discussing with their patients over 65. Spinach, along with beet greens, celery, and arugula, is naturally very high in nitrates. In their fresh state, those nitrates are largely harmless and even beneficial. But when you cook spinach, the nitrates begin converting. And when you reheat it a second time at high temperatures, whether in a microwave or on the stovetop, those nitrates convert further into compounds called nitrosamines. Think of nitrosamines like tiny arsonists moving through your digestive system, setting off fires of cellular inflammation wherever they land. Research out of the Karolinska Institute in Stockholm found that repeated thermal processing of high nitrate vegetables led to a 3.4-fold increase in nitrosamine concentrations compared to freshly prepared vegetables. And here's the part that specifically concerns me for my senior patients. After the age of 70, your body's natural ability to neutralize these compounds declines by approximately 40%. The enzyme systems in your liver that would normally detoxify these substances, enzymes called glutathione S-transferases, become significantly less efficient as we age. So the same amount of reheated spinach that might be harmless to a 35-year-old can deliver a measurably higher toxic load to a 72-year-old body. The pancreas is particularly vulnerable here because it sits right in the middle of the digestive process, acting like a chemical processing plant for everything you eat. When nitrosamines reach the pancreatic tissue repeatedly over months and years, researchers at Johns Hopkins School of Medicine have documented that they can trigger a process called ductal cell mutation, essentially forcing the cells that line the pancreatic ducts to begin replicating abnormally. That is, quite literally, how cancer begins. I had a patient, let me call her Dorothy, a 71-year-old retired school teacher from Savannah, Georgia. Dorothy was the picture of health-conscious living. She ate spinach nearly every day, cooked a big batch on Sunday, and reheated it throughout the week. She came to me after a routine scan showed early abnormalities in her pancreatic region. When we reviewed her dietary habits together, the reheated leafy greens pattern jumped out immediately. We changed her approach. She now prepares small, fresh portions each time. And her follow-up imaging showed significant improvement in the inflammatory markers we were tracking. Dorothy's story is not unique. I see this pattern repeatedly. So what do? First, prepare leafy greens fresh every single time if you possibly can. If you must cook in batches, eat them cold rather than reheating. Cold spinach in a salad is completely safe. And if you do reheat, do it only once, very gently, at low heat for the shortest possible time. Never microwave spinach twice. The synergy tip here is important. Always pair your leafy greens with a source of vitamin C, a squeeze of lemon, some fresh tomato, because vitamin C has been shown to inhibit nitrosamine formation by up to 73% according to research from the University of California, Davis. But if reheated spinach surprised you, wait until you hear about number 4. This one is in almost every senior's refrigerator right now. Number 4 on our list is reheated rice, and I cannot stress enough how commonly this danger is completely overlooked by both patients and, frankly, many physicians. Here's what happens. When rice is cooked, the starch structure changes, and the warm, moist environment becomes an extraordinarily hospitable home for a bacterium called Bacillus cereus. Now, most people have heard that leaving rice out is dangerous, and they think, well, I put it in the refrigerator right away, so I'm safe. But here's what the food safety research actually tells us, and this comes from a comprehensive review by the European Food Safety Authority involving data from over 48,000 food poisoning cases. Refrigeration slows Bacillus cereus growth dramatically, but it does not eliminate the bacterial spores. Those spores are heat resistant, and when you reheat refrigerated rice, especially in a microwave where heating is uneven, those spores survive, and the toxins they have already produced, toxins that were generated even during refrigeration, are not destroyed by reheating. Now here's the critical link to pancreatic cancer that most people miss entirely, and this is where the research gets genuinely disturbing. These bacterial endotoxins, when consumed repeatedly over time, trigger a chronic low-grade inflammatory response in the gut lining. Researchers at the University of Michigan Medical School published findings in 2019 showing that chronic gut endotoxemia, that's a sustained presence of bacterial toxins in your bloodstream, was associated with a 58% higher incidence of exocrine pancreatic dysfunction in adults over 65 compared to those without detectable endotoxemia. The pancreas, you see, is intimately connected to your gut through a network of blood vessels and lymphatic channels. What damages your gut repeatedly damages your pancreas silently over years. After the age of 65, your gut lining, called the intestinal epithelium, loses roughly 30% of its regenerative capacity. Think of your gut lining like a brick wall. In younger people, damaged bricks are replaced quickly and efficiently. But after 65, that repair crew slows down considerably, meaning toxins can get through the wall more easily, enter the bloodstream, and reach the pancreas before your immune system can neutralize them. The solution here is straightforward but requires a change in habit. Ideally, cook rice fresh every time in small portions. But if you must store it, cool it as rapidly as possible. Spread it on a flat tray to cool it within 1 hour, then refrigerate immediately and consume within 24 hours. When reheating, ensure the rice reaches a core temperature of at least 165 degrees Fahrenheit throughout, not just on the surface. Use a food thermometer, add a tablespoon of water before microwaving, and cover it to create even steam distribution. The synergy tip: consume your rice with a probiotic-rich food like a small serving of plain yogurt or kefir alongside your meal, because the beneficial bacteria compete with Bacillus cereus in your gut and can reduce endotoxin absorption by a clinically meaningful degree. We are now halfway through our list, and I want to pause for just a moment to say, if this video is opening your eyes, if you feel like you're learning things that your doctor's 15-minute appointment never had time to cover, please take 2 seconds right now to hit that subscribe button and give this video a like. We have thousands of seniors depending on this channel for information that genuinely protects their health, and your support is what allows us to keep producing this research-backed content completely free. Hit subscribe right now. It costs you nothing, and it may protect someone you love. Now, let's talk about number 3, because this one causes genuine shock in my patient consultations every single time I bring it up. Number 3 on our list is reheated chicken, and specifically the proteins in reheated poultry, which undergo a chemical change that has direct and documented implications for pancreatic health in aging bodies. Chicken is one of the most popular proteins among health-conscious seniors, and for good reason. It's lean, it's versatile, and it's affordable. But here's the science that the meal prep industry will never put on their packaging. When chicken is cooked, the proteins denature. They unfold, which is exactly what cooking is supposed to do. But when you then refrigerate that cooked chicken and reheat it, particularly above 165 degrees Fahrenheit, and especially in high heat methods like the microwave or a very hot pan, those already denatured proteins undergo a secondary transformation. Heterocyclic amines. Let me explain that term immediately. These are toxic chemical compounds that form when amino acids and creatine in muscle meat react with high heat for the second time. A study published in Cancer Epidemiology, Biomarkers and Prevention, one of the most respected oncology journals in the world, found that high intake of heterocyclic amines was associated with a 2.1-fold increased risk of pancreatic cancer in adults over the age of 60 compared to those with low intake. But why are seniors specifically at greater risk from this mechanism? Because after the age of 70, a process called anabolic resistance kicks in significantly. Anabolic resistance means your cells become less efficient at processing and utilizing proteins correctly. Think of it like a mail sorting facility where half the workers have called in sick. The proteins from reheated chicken arrive malformed, and your already struggling cellular machinery has a much harder time deciding what to do with them. The result is that these heterocyclic amine compounds spend more time in your digestive tract and are more likely to reach the pancreatic tissue before being neutralized. Additionally, the pancreas produces digestive enzymes specifically designed to break down fresh, properly structured proteins. When denatured, reheated proteins arrive, the pancreas has to work significantly harder. It oversecretes these enzymes in a stress response, and chronic oversecretion of pancreatic enzymes is one of the documented precursors to pancreatic inflammation, a condition called chronic pancreatitis, which itself is one of the strongest known risk factors for pancreatic cancer. Research from the Mayo Clinic estimates that individuals with chronic pancreatitis face a 13 to 18 times higher lifetime risk of developing pancreatic cancer compared to the general population. Let me tell you about my patient Gerald, a 68-year-old retired firefighter from Portland, Oregon. Gerald was meticulous about his health. He meal prepped every Sunday, cooking a large batch of chicken breasts that he reheated for lunch and dinner throughout the week, often in the microwave on high for 2 to 3 minutes. When Gerald came to me with unexplained digestive discomfort and elevated lipase levels, lipase is a pancreatic enzyme, and elevated levels signal pancreatic stress, we discovered this reheating pattern. We transitioned Gerald to consuming his chicken cold in salads or reheating very gently with moisture at lower temperatures for longer durations. Within 3 months, his lipase levels had normalized and his digestive symptoms had resolved completely. The practical guidance: if you're reheating chicken, add moisture, a splash of broth or water, cover it, and use the lowest effective temperature setting. Never microwave chicken on high. Alternatively, slice it cold and add it to soups or salads. The synergy tip: always pair your chicken with cruciferous vegetables like broccoli or Brussels sprouts, because these contain a compound called sulforaphane that has been shown in research at Johns Hopkins to actively suppress the carcinogenic activity of heterocyclic amines by up to 39%. Number 3 has been alarming. But what comes next, the second most dangerous reheated food for your pancreas, made headlines in European medical journals 2 years ago. and it involves something Americans eat in extraordinary quantities. Number 2 on our countdown, and I want you to really pay attention here, is reheated potatoes, including mashed potatoes, roasted potatoes, French fries that have been reheated, and potato-based dishes that go from the refrigerator back to a heat source. Potatoes are the most consumed vegetable in the United States. Seniors in particular rely on them heavily as a comforting, affordable, easy-to-prepare staple. And this is precisely why this information is so critical and so underreported. When potatoes are cooked at high temperatures, baking, frying, roasting, a chemical reaction called the Maillard reaction produces a compound called acrylamide. Now, acrylamide in a first cooking is concerning enough. The International Agency for Research on Cancer, the IARC, which is part of the World Health Organization, classifies acrylamide as a Group 2A probable human carcinogen. But when you take those already cooked potatoes, refrigerate them, and then reheat them again at high temperatures, the acrylamide content can increase by an additional 60 to 80% compared to the first cooking, according to research conducted by the Swedish National Food Administration and subsequently confirmed by scientists at the University of Reading in the United Kingdom. Here is the specific mechanism that makes aging bodies uniquely vulnerable to this compound. Acrylamide is what chemists call an electrophilic compound, meaning it seeks out and binds to proteins in DNA. In younger bodies, robust DNA repair mechanisms can catch and correct the genetic damage acrylamide causes before it leads to mutation. But research from the National Institute on Aging shows that after the age of 65, DNA repair efficiency decreases by approximately 35 to 45%. So the same acrylamide load that a 40-year-old might handle without issue becomes significantly more genetically damaging to a 70-year-old whose cellular repair crew is working at half capacity. The pancreas is specifically targeted by acrylamide because of the way the compound is metabolized. In your body, acrylamide converts to a substance called glycitamide, which binds directly to DNA in actively dividing cells. The pancreatic ductal cells, which line the tubes that carry digestive enzymes, divide relatively frequently, making them particularly susceptible to glycitamide-induced mutations. A large European cohort study, the EPIC study, which followed over 520,000 participants across 10 European countries, found that high dietary acrylamide exposure was associated with a statistically significant increase in pancreatic cancer risk, particularly in non-smokers, meaning this was the food effect independent of any smoking history. The mitochondria in your pancreatic cells, think of mitochondria as the power plants inside every cell in your body, also suffer specific damage from acrylamide exposure. And after the age of 70, mitochondrial function has already declined by up to 40% from your peak. Compromised mitochondria in pancreatic cells means those cells have less energy to maintain healthy function and less capacity to initiate the self-destruction process called apoptosis that normally eliminates mutated cells before they become cancerous. What should you do? The safest approach with potatoes is to cook and eat them fresh every time, consuming them immediately after the first cooking. If you have leftover potatoes, eat them cold. Cold potato salad, for example, is far safer than reheated roasted potatoes. And interestingly, cold cooked potatoes also have a higher resistant starch content, which is actually beneficial for your gut microbiome. If you must reheat, do it gently, in a covered pan with a little water or broth on the lowest heat setting, avoiding any browning or crisping, because it's the high heat browning that generates the most acrylamide. The synergy tip: consume potatoes alongside rosemary or rosemary extract, because research published in the Journal of Agricultural and Food Chemistry found that rosemary compounds called diterpenes can reduce acrylamide formation by up to 40% through competitive inhibition of the Maillard reaction. Now we have arrived at number 1, and I promised you that this would be shocking. I promised you it would be something you eat regularly, something you consider healthy, something that has never triggered a single alarm bell in your mind. I want you to take a breath, because what I'm about to tell you is the most important dietary warning I've issued in years of making this content. The number 1 most dangerous reheated food for your pancreatic health, The food that has the strongest documented link to pancreatic cancer in seniors specifically is reheated vegetable oils and foods cooked in them. I'm talking about any food that was cooked in vegetable oil, canola oil, sunflower oil, corn oil, soybean oil, that is then reheated. Stir-fried vegetables from last night, sautéed dishes, store-bought rotisserie foods, any restaurant leftovers, any takeout that gets popped back in the microwave. If it was originally cooked in a polyunsaturated vegetable oil and you're reheating it, you need to understand what is happening at a molecular level. Polyunsaturated vegetable oils are chemically unstable at high temperatures. When they are first heated, they begin producing toxic compounds, particularly a group called aldehydes, and most critically, a specific aldehyde called 4-hydroxynonenal, or 4-HNE. I'll explain exactly what this is. 4-HNE is a highly reactive molecule that forms when the omega-6 fatty acids in vegetable oils are oxidized by heat. The first cooking creates significant amounts of this compound. When you then reheat that food, whether in a microwave, oven, or stovetop, the already degraded oil undergoes further oxidation, and 4-HNE concentrations can reach levels that are frankly alarming. Professor Martin Grootveld of De Montfort University in Leicester, England, conducted groundbreaking research on this topic that was presented at a Royal Society of Medicine conference, and his findings were staggering. He found that reheating common vegetable oils produced concentrations of toxic aldehydes that exceeded the World Health Organization's recommended safe limits by factors of 18 to 20. Not 18 to 20% above the limit, 18 to 20 times the limit, and that's from a single reheating. The connection to pancreatic cancer is direct and mechanistically well understood. 4-HNE and related aldehydes are what scientists call genotoxic, meaning they directly attack and damage DNA. The pancreatic acinar cells, the cells responsible for producing the enzymes your body uses to digest food, are among the most metabolically active cells in your entire body. They are constantly producing and secreting huge quantities of protein-based enzymes, and this metabolic activity means they consume oxygen rapidly. High oxygen consumption creates oxidative stress, and oxidative stress makes these cells particularly vulnerable to 4-HNE damage. Research published in the journal Gut, one of the most prestigious gastroenterology journals in the world, found that elevated 4-HNE concentrations in pancreatic tissue were present in 89% of pancreatic ductal adenocarcinoma samples studied, which is the most common and most deadly form of pancreatic cancer. Now, here is the aging-specific dimension that makes this so much more urgent for every senior watching this video right now. After the age of 65, your body's production of a master antioxidant called glutathione decreases by roughly 50%. Glutathione is your body's primary defense against aldehyde toxicity. It's the cleanup crew that neutralizes 4-HNE before it can reach your DNA. With half the cleanup crew gone, twice as much 4-HNE reaches your pancreatic cell nuclei and begins its damage. Simultaneously, the natural anti-inflammatory signaling molecule called NRF2, which normally activates your cellular defense genes, becomes 40% less responsive in aging cells. Think of NRF2 like a fire station alarm system. In your 40s, the alarm goes off immediately and the fire trucks are on the road before the fire spreads. After 70, that alarm system has corroded and the fire spreads significantly before any response is mobilized. The compounding effect of chronic 4-HNE exposure on a glutathione-depleted NRF2-compromised aging pancreas is, in the honest scientific assessment of the researchers who have spent their careers studying this, one of the most underappreciated dietary cancer risks in the modern world. I want to share a story with you. Margaret, a 74-year-old retired nurse from Phoenix, Arizona, someone who understood health better than most people, came to me after being diagnosed with early-stage pancreatic irregularities that her gastroenterologist wanted to monitor closely. Margaret ate what most people would consider an excellent diet: plenty of vegetables, limited red meat, no processed junk food. But she cooked almost exclusively with canola and sunflower oil. She always made large batches, and she reheated her meals every single day. When we identified this pattern together, Margaret was genuinely disbelieving at first. She said, "Dr. Lee, I've been using these oils for 30 years, and I thought they were the healthy choice." And they can be for a first cooking at appropriate temperatures. But the reheating, day after day, year after year, had created a cumulative aldehyde burden on her system that her aging antioxidant defenses simply could not match. We transitioned Margaret to cooking fresh portions in stable fats, extra virgin olive oil, butter, or coconut oil, all of which are significantly more heat stable and produce far fewer toxic aldehydes, and to consuming leftovers cold wherever possible. Her most recent monitoring showed stabilization of the previously concerning tissue changes, and her inflammatory blood markers dropped by over 30% in 4 months. So, what is the practical guidance here? This is critical. First, switch your cooking oils immediately. Extra virgin olive oil, because of its high oleic acid content and polyphenol antioxidants, is dramatically more stable at cooking temperatures and produces a fraction of the aldehydes that canola or sunflower oil produce. Butter and ghee are also significantly more stable for high heat cooking. Second, and I cannot emphasize this strongly enough, never reheat food that was originally cooked in a polyunsaturated vegetable oil. Eat it fresh, eat it at room temperature, eat it cold, but do not add a second heat exposure. Third, when you order restaurant food or buy prepared foods, assume they were cooked in vegetable oil, because they almost certainly were, and do not reheat them at home. The synergy tip here is of extraordinary importance. Supplement your diet daily with vitamin E in its gamma tocopherol form and with N-acetylcysteine, NAC, because both of these nutrients directly boost your body's production of glutathione, restoring some of the antioxidant defense capacity that aging has diminished. Research from Tufts University's Human Nutrition Research Center on aging found that supplementation with these compounds in adults over 65 led to measurable increases in glutathione levels within 6 weeks. As always, consult your physician before beginning any new supplement regimen, and I will include scientific references for everything I've discussed today in the description below this video. Now I want to take a moment and speak to you directly, not as a physician reviewing data, but as someone who deeply cares about the quality of the years you have ahead of you. You did not come this far through the decades you have lived, the challenges you have overcome, the family you have built, the life you have created, to have your health quietly undermined by something as avoidable as how you handle your leftovers. Pancreatic cancer is one of the most devastating diagnoses anyone can receive, and a staggering proportion of its risk factors are modifiable. That means you have power here. Real, meaningful, actionable power. The habits we discussed today, cooking spinach fresh, handling rice carefully, reheating chicken gently, never rebrowning your potatoes, and switching to stable cooking oils, these are not extraordinary demands. They are small, practical adjustments that compound over time into profoundly different health outcomes. I have seen patients in their late 70s make these changes and watch their inflammatory markers drop, their energy improve, and their peace of mind return. I have seen 80-year-olds take information like what you've learned today and use it to protect themselves and educate their children and grandchildren. It is never too late. The science is absolutely clear that your body retains the capacity to respond positively to dietary improvements at any age. Your pancreas, your gut, your cellular repair systems, they are waiting for you to give them the right environment, and they will respond. Your independence, your vitality, your ability to live fully on your own terms. These are worth protecting with every meal you prepare. If you found this video valuable, please subscribe to this channel right now if you haven't already. We publish evidence-based health information for seniors every single week, and I promise you, every video is built on the same commitment to your well-being that you've seen here today. Share this video with someone you love, a parent, a sibling, a friend. because this information genuinely has the power to change outcomes.